Hello everybody. I thought I'd make a small video to explain the answers for this. This is a Dermateaser quiz. It's not really a Dermpath quiz, but a Dermateaser quiz. But an interesting one because it's a conundrum we often find ourselves in. So this is the history of a 4-week-old boy, a product of a consanguineous marriage. This history is completely irrelevant actually to this particular diagnosis. Presented with an ill-defined, and that's probably more important, ill-defined pink patch on the right forehead, present and unchanged since birth. Birth history was non-traumatic, spontaneous vaginal delivery. And again, this probably has some relevance, but probably not, because these lesions occur irrespective of the mode of delivery and are present in about one third or more actually of newborn infants. But the history is classical. The parents mentioned that the lesion got worse on crying. In fact, the lesion may not be visible in normal circumstances and may only be visible when the baby cries. And this is a typical example of a salmon patch, a capillary malformation, or it is also called a nevus flammeus. Now, there are two types of nevus flammeus, and these have been clubbed together now. The first one is something like this, a salmon patch. And the same thing occurs on the forehead. It's believed that the angels have kissed the baby and it's called an angel's kiss. If the same thing has occurred forehead, I mean in the glabella region. If the same thing has occurred on the back of the neck, it's called a stork bite, because storks carry the infants, in sort of cartoons and in mythological stories, storks, which are birds with long beaks, they carry infants, babies on the back of the neck, and when the storks bite, it may leave a mark, and that's why it's called a stork's bite if it occurs on the back of the neck. Now, the significance of a stork's bite is that most of these capillary malformations, I mean salmon patches and angel's kiss, usually resolve on their own within 1 or 2 years, and that's more or less the rule. They tend to get better on their own without any treatment whatsoever, and therefore waiting and watching is the only approach you need to take. While stork's bite tends to persist, most of them tend to persist into adult life, and if cosmetically unacceptable, then these need treatment with a KTP laser. Now, there is another type of nevus flammeus which lasts lifelong, and that is called a port wine stain. That is the example I've given here. Port wine stain is much more well defined. It's much more lateralized. Usually involves the trigeminal, area, and it is associated with vascular malformations inside the brain. Leptomeningeal angiomatosis, and it's associated with. It may be associated with changes inside the ipsilateral eye, causing glaucoma. Often brain changes may lead to cerebral atrophy on that side, or calcification, which may cause seizures, and that may be a manifestation of this. Headaches are also an early manifestation of the same thing, and the combination of this is called Sturge-Weber syndrome. And if you have this port wine stain on the leg, it may cause limb hemihypertrophy, when you call it Klippel-Trenaunay syndrome, and often associated with lymphatic malformation as well. All right. Now, so in port wine stains, how do you differentiate port wine stains from? So how do you differentiate the nevus flammeus, which resolves spontaneously, i.e., the salmon patch, which also occurs in the eye region, from a port wine stain? Salmon patch typically is very faint, ill-defined borders. When you have well-defined borders like this, then it's called a port wine stain. But if there are some cases which overlap in the initial phases, you may not be able to differentiate them, in which case waitful watching is the best approach. Now, in these cases, how can you differentiate them histologically? Unfortunately, not. Both of them just show ectatic vessels, and they cannot be differentiated histologically. In port wine stain, there is a genetic defect in the GNAQ gene on chromosome 9q21. But nevus flammeus is common. Salmon patches are present in about 1/3 of infants. So, it's an extremely common thing. If you go around testing everyone, it's a waste of time. Waitful watching is the best approach. An MRI scan should not be done unless there is, if you're suspecting a port wine stain, or there are any other signs to suggest a Sturge-Weber syndrome. And yes, the answer therefore is no testing is needed. And when such lesions occur on the leg, when such lesions occur on the leg, such lesions do not occur on the leg. It's only when port wine stain occurs on the leg does it cause limb girth discrepancy, not nevus, not these kind of salmon patches or these faint red erythematous patches. And these in fact only usually occur on the head and neck. The treatment choice is pulse dye laser done as early as possible. Not for this particular patch, but if it occurs on the neck, then yes. But then psychological distress is not an issue with stork's bite, and therefore pulse dye laser should not be done routinely, only if in adult life if it's cosmetically unacceptable, because back of the neck is hardly a cosmetically sensitive area. Glaucoma is a known association of port wine stain, not this. Facial lesions tend to regress spontaneously, yes, and that's what I've explained earlier. Histologically characterized by an intradermal or subcutaneous multilobular proliferation of numerous small vascular spaces lined by plump endothelial cells. This is a description of an hemangioma. It's not a description of a capillary malformation. Okay, so this patient typically has Sturge-Weaver syndrome because I've mentioned drug history. She's been on phenytoin, obviously for epilepsy. All right, and headaches may be also a common feature, as said. And the treatment of choice is pulse dye laser. It definitely needs to refer to the ophthalmologist to look for intraocular involvement. Definitely needs an MRI brain scan to exclude cerebral involvement. No cardiology referral is necessary because there's no usual heart association or cardiac association. And this is a stork's bite. Otherwise, it's not called an angel's kiss. And most of these do not spontaneously regress. Treatment of choice is pulse dye laser. Yes, that is the treatment of choice. Maybe associated with Birt-Hogg-Dubé syndrome is false. Yes, maybe associated with Sturge-Weaver syndrome is also false. All right, I hope you enjoyed the quiz. Thank you very much.